Hello my friends, my name is Dr. Said Kazmi and today I'm going to talk about what is the diagnostic algorithm for diagnosis of hepatitis B. Whenever you come across a patient where you suspect that he or she might be having hepatitis B, there is an algorithm to follow. Now remember, for hepatitis B diagnosis, there are serological tests and virological tests. So remember, serological and virological. In serology, you should remember two things. There are antigens and antibodies. And again, there are two antigens and two antibodies that you need to understand. As far as the hepatitis B antigens are concerned, number one, hepatitis B surface antigen and hepatitis B E antigen. So surface antigen and E antigen, and two antibodies. Number one, hepatitis B core antibody. So core antibody again can be of two types, IgG or IgM. And the second antibody is hepatitis B surface antibody. So two antibodies, core antibodies and surface antibodies. And as far as the virological tests are concerned, it is just hepatitis B viral DNA, which is done via the PCR method. So let's first start with the serological markers. So if you suspect that somebody has got hepatitis B, the first screening test is hepatitis B surface antigen. So if the hepatitis B surface antigen is positive, then you would do further test, and if the hepatitis B surface antigen is negative, then you can do some further test as well. So if the hepatitis B surface antigen is positive, it means that the person has got hepatitis B infection. Now, you need to do further tests. Now, the first test that you would do if the patient has hepatitis B surface antigen positive is the hepatitis B E antigen. Now, the E antigen actually tells you if the person is infective or not, and that simply means an acute infection. So if the hepatitis B E antigen is positive, that person has got an acute hepatitis B, and it means that the person is infective. If the hepatitis B E antigen is negative, it simply means that the person is not infective to others or has got low infectivity, but he still has got hepatitis B. In that particular case, you have to do what? You have to do anti-hepatitis C antibodies. These are known as hepatitis B C core antibodies, which are of two types, IgM and IgG. So if these antibodies are present, you see whether it's of the IgM or IgG type. If IgM antibodies, core antibodies are positive, it means an acute infection. Or if the IgG type is positive, the core antibodies, then it means that this person has got chronic hepatitis B, because hepatitis B can go into the chronicity as well, or the chronic phase as well. So if the hepatitis B surface antigen is positive, you will do hepatitis B E antigen number one, and you will do hepatitis B core antibodies. If E antigen is positive, it means he is infective. If the core antibodies are positive, you have to see whether it's IgM or IgG. If IgM, it means acute hepatitis B infection. If it is the IgG type, that means chronic hepatitis B. So that is for if the person has got hepatitis B surface antigen positive. Now, what if the hepatitis B surface antigen is negative? It simply means that the person has not got hepatitis B. You can, in most of the cases, you won't, you don't want to do anything after that if somebody has got hepatitis B negative. But for understanding and for academic purposes, if you want to know if this negative status is because this person has recovered or had a past infection, or this person is simply immunized, what you need to do is you can do two further tests if the person has got hepatitis B surface antigen negative. First is to see if this person has got hepatitis B surface antibodies present or not, because if the surface antigen is negative and surface antibodies are positive, okay, then it means that this person has got prior what? He's got prior immunity in the form of vaccination. Or it's simply that person might be having had an infection in the past from which he has fully recovered. There is one tricky thing here as well, which we call as a window period, because normally the surface antigen would take at least somewhere between 6 weeks to 6 months to become positive, and during this time the person might be having hepatitis B virus in his body, but his surface antigen would be negative. So in that particular case, if you are doing the hepatitis B core antibodies and if the IgM is positive, okay, surface antigen is negative, but the IgM core antibody is positive, then it means that this person is what? He is in the window time period. But let's say this IgM is negative, but the IgG type is positive, then it simply means that this person had an infection, hepatitis B infection somewhere in the past from which he has fully recovered. So this way, if the hepatitis B surface antigen is negative and you do surface antibodies and you do anti-core antibodies, that would give you an idea whether this person was vaccinated or has been vaccinated and has got full immunity, or whether this person had a past infection from which he has fully recovered, or more tricky thing, whether he's in the what we call as the window period. In window period, surface antigen is negative, but the IgM core antibody is positive. It simply means he's within that somewhere between 6 weeks to 6 months where he has not fully developed the surface antigen positivity, but his core antibodies have turned positive. So it's important that you always check them with in that particular case with viral DNA loads to see how much is the viral DNA, because the treatment of the hepatitis B sometimes depend on how much is the viral load. And as a supplementary test, you can also do, especially if the person is hepatitis B surface antigen positive, that is a liver function test to see how much is the degree of liver inflammation or liver damage. So in a nutshell, if you suspect hepatitis B, remember 2 antigens and 2 antibodies. If the surface antigen, start always with surface antigen levels. If the surface antigen is positive, go with hepatitis E antigen and anti-hepatitis core antibodies of the IgM and IgG, and then you can further work up with viral DNA loads and checking for liver inflammation. If the person is hepatitis surface antigen negative, then you have to check hepatitis B surface antibodies and also the hepatitis B core antibodies, just to make sure whether this person is in the window period or whether he has got a prior immunity in the form of either a past infection or prior vaccination. So I hope you have understood the interpretation of serology and virology in the diagnosis of hepatitis B. Have a very good day. Take care and bye-bye. Signing off.